A symptom is a sign or feeling that suggests a health problem. A diagnosis is the identification of a disease based on information such as symptoms and tests. A prognosis is a prediction of how a disease will likely progress over time. Treatment is any medical action intended to improve a patient's condition. Medication is a drug used to prevent, treat, or relieve a medical condition. A dose is the amount of a medication taken at one time or within a specific period. A side effect is an unintended effect of a medication or treatment. An allergy is an immune reaction to a substance that is usually harmless. An infection is the invasion and growth of harmful microorganisms in the body. Inflammation is the body's response to injury or infection, often causing redness and swelling. An injury is physical harm to the body caused by an accident or external force. Surgery is medical treatment that involves operating on the body to repair or remove tissue. A procedure is a specific medical method or series of steps used to diagnose or treat a condition. A prescription is an official instruction from a clinician for a patient to receive a medication. An antibiotic is a medication that kills bacteria or stops them from growing. A vaccine is a biological preparation that helps the immune system prevent a specific disease. Blood pressure is the force of circulating blood against the walls of the arteries. Heart rate is the number of heartbeats per minute. A patient is a person who receives medical care or treatment. A physician is a medical doctor who diagnoses and treats illnesses. A nurse is a licensed healthcare professional who provides patient care and monitoring. A clinic is a healthcare facility that provides outpatient medical services. A hospital is a medical institution that provides diagnosis, treatment, and inpatient care. An emergency is a sudden, serious condition that requires immediate medical attention. Triage is the process of prioritizing patients based on the urgency of their condition. A vital sign is a measurable indicator of basic body function, such as temperature or pulse. A fever is an elevated body temperature that often indicates infection or inflammation. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. A rash is a visible change in the skin, often involving redness or bumps. A cough is a reflex that clears the airways by expelling air forcefully. Shortness of breath is difficulty breathing or the feeling of not getting enough air. Nausea is the feeling that you are about to vomit. Vomiting is the forceful expulsion of stomach contents through the mouth. Diarrhea is frequent, loose, or watery bowel movements. Constipation is infrequent or difficult bowel movements. Dehydration is a condition in which the body lacks enough water and fluids to function properly. An examination is a clinical evaluation performed to assess a patient's condition. A physical exam is an assessment of the body using inspection, touch, and simple tests. A lab test is an analysis of a sample such as blood or urine to obtain medical information. Blood work is laboratory testing performed on a blood sample. Urinalysis is a test that examines urine to help detect disease or infection. An imaging test is a test that creates pictures of the inside of the body to aid diagnosis. An X-ray is an imaging test that uses radiation to visualize bones and some tissues. Ultrasound is an imaging method that uses sound waves to produce images of internal organs. CT is an imaging test that uses multiple X-ray images to create cross-sectional views of the body. MRI is an imaging test that uses magnetic fields and radio waves to create detailed images of soft tissue. A biopsy is the removal of a small tissue sample for microscopic examination. An N4 is a method of delivering fluids or medication directly into a vein. An injection is the delivery of a substance into the body using a needle and syringe. An infusion is the slow administration of fluids or medication, often through an N4 line. An anesthetic is a drug that reduces or prevents pain during a procedure. Anesthesia is the state of pain control and reduced sensation produced by anesthetic drugs. A wound is an injury that damages the skin or other tissues, often with bleeding. A suture is a stitch used to close a wound or surgical incision. A bandage is a material used to cover and protect a wound. A chronic condition is a long-lasting health problem that often requires ongoing management. An acute condition is a sudden-onset health problem that develops quickly. A screening test is a test used to detect disease in people without symptoms. Prevention is the set of actions taken to reduce the risk of disease or injury. Informed consent is a patient's agreement to a medical procedure after receiving and understanding the relevant information.